Menstrual hygiene is a fundamental aspect of women's health that affects millions of people worldwide. Proper menstrual hygiene management not only ensures physical comfort and health, but also supports dignity, confidence, and overall well being during menstruation. Wash your hands before and after touching any menstrual product. Wet your hands with warm water, add soap, and rub every part for about 20 seconds, the time it takes to sing the ABC song twice. Soap and scrubbing loosen germs that could travel from your fingers to your pad, tampon, or cup. Rinse well, then dry with a clean towel or under a hand dryer so new bacteria do not stick to damp skin. Dry hands also help you hold products without slipping. Making this quick habit part of every change keeps infections away and keeps you feeling fresh. Change disposable pads every 4 to 6 hours and tampons every 4 to 8 hours. Fresh products soak up blood better, stop leaks, and keep skin from getting soggy or itchy. If a pad or tampon stays in too long, bacteria can grow and cause bad odors or painful rashes. With tampons, leaving one in for more than 8 hours can trigger toxic shock syndrome, a rare but serious illness. On heavy flow days, you may need to change sooner, and that is perfectly normal. Carry extra supplies so you never have to wait when you start to feel damp. Empty, rinse, and reinsert menstrual cups at least twice a day, then boil them for 1 to 2 minutes after each cycle. To empty a cup, pinch the base, pull it out slowly, and pour the blood into the toilet. Rinse the cup with clean water or a little unscented soap, then wipe or shake off the water and place it back in. Doing this morning and night keeps the cup comfortable and clean. When your period ends, drop the cup in boiling water for 1 minute or 2 minutes. Heat destroys hidden germs that rinsing can miss. After it cools, store the cup in a breathable cloth bag so it stays dry and ready for next month. Wash reusable cloth pads in hot water with mild soap, rinse well, and sun dry them completely. First, soak a used pad in cold water to help remove stains. Next, scrub it in hot soapy water until the water runs clear, making sure the soap is gentle so it does not irritate your skin later. Rinse out all soap, squeeze out extra water, and hang the pad in bright sunlight. Sunlight's heat and UV rays kill leftover germs. If the weather is rainy, iron the dry pad on low heat instead. Store pads in a clean cotton bag so they stay fresh and ready to use again. Clean the vulva daily with plain water or mild, unscented soap. Never douche or use scented washes. The vagina cleans itself on the inside, so you only need to wash the outer area, called the vulva. Use your hand, warm water, and a gentle soap if you like. Never spray inside because that removes healthy bacteria and upsets the natural pH. Rinse well to get rid of all soap, then pat dry with a soft towel. Good washing keeps away itching, bad smells, and infections. If you notice pain, burning, or a strong odor, talk to a trusted adult or nurse. Wipe from front to back after using the toilet. Always wipe the urethra and vagina first and the anus last, so germs from poop do not travel forward. This simple motion lowers the risk of urinary tract infections and keeps your period blood cleaner on the pad. Use soft toilet paper to avoid scratching sensitive skin. If possible, wash your hands and the area with water afterward for extra cleanliness. Turning this into a habit every time you use the toilet protects you all month long. Wear breathable cotton underwear and change it whenever it becomes damp. Cotton lets air move through the fabric, pulling sweat and moisture away so your skin stays cool. Synthetic or very tight underwear traps heat and wetness that let bacteria or yeast grow, causing itch or rash. If your underwear gets sweaty after sports or damp from leaks, switch to a dry pair as soon as you can. Wash used pairs with mild soap and warm water, then dry them completely before wearing again. Clean, dry underwear helps you feel comfortable and confident all day. Use the lowest absorbency tampon that still controls your flow. A tampon that is too large stays drier inside your body, giving harmful bacteria a place to grow, which can increase toxic shock risk. Start with a regular size. If you soak through in less than 4 hours, go up one level, but not more. Change the tampon before it feels full or hard to remove. You can test by gently pulling the string. If it slides out easily, the absorbency is right. If it feels stuck, switch to a lighter one next time. Following this rule keeps you safer and more comfortable. Dispose of used pads and tampons by wrapping them in tissue or the product's wrapper and placing them in a covered bin, never the toilet. Wrapping locks in odor and keeps blood from touching other surfaces. Flushing pads or tampons can clog toilets, damage pipes, and hurt wastewater systems. In public restrooms, look for the small metal or plastic container marked for sanitary waste and drop the wrapped item inside. If no bin is handy, carry a resealable bag until you find one. Proper disposal protects the environment and is kinder to workers who handle trash. Keep spare products, wet wipes, and a resealable bag for soiled items in your backpack or purse. A small period kit means you are prepared if your flow starts early or supplies run out at school. Include 2 or 3 pads or tampons, a pair of clean underwear, and a few gentle wet wipes for quick cleanups. Pack a zipper or snap lock bag to hold used items if no trash can is nearby. Restock the kit each night so it is ready for the next day. Being prepared helps you stay calm and active, no matter where you are. Stay hydrated and eat an iron-rich, balanced diet. Drinking 6 to 8 cups of water each day replaces liquids lost in blood and helps prevent headaches. Eat iron-rich foods such as spinach, beans, eggs, and lean meat to rebuild red blood cells and fight tiredness from blood loss. Pair these foods with vitamin C sources like oranges or strawberries so your body absorbs the iron better. Whole grains, nuts, and yogurt add protein and healthy fats for energy. Good nutrition supports strong muscles and a healthy mood throughout your cycle. Track your cycle with a calendar or free phone app and note any sudden changes in timing, flow, or pain. Mark the first day of each period, how many days it lasts, and how heavy it is. After a few months, you will see a pattern that helps you predict the next period and plan for sports, trips, or exams. If your cycle suddenly shortens, lengthens, gets very heavy, or becomes much more painful, share this information with a parent, nurse, or doctor. Clear records help healthcare workers spot hormone issues, thyroid problems, or other conditions faster. Knowing your own pattern also teaches you to listen to your body. Schedule an annual gynecological checkup that includes a pelvic exam and pap smear. Starting around age 21, a yearly visit lets a health professional check for infections, abnormal cells, or other concerns long before you notice symptoms. During the visit, you can ask about cramps, acne, or birth control in a private, safe space. The pap smear tests cervical cells for early changes that, if untreated, could lead to cancer. Early treatment is simple and highly effective. Regular exams keep your reproductive system healthy and give you expert advice for any questions. Making these visits a habit shows you value your health and well-being.